Do you need to have a Medicare Part D prescription drug plan? Follow me here to learn more. Let's talk about this. So, the person who wrote the question only takes one medication. Her medication is less expensive than the monthly premium. So, she's trying to figure out if it makes sense to keep a drug plan. So, my answer is I would keep the plan. So, let me explain to you why. The Medicare annual election period is coming up. It's October 15th to December 7th. That is the time of year where you make the change. So a lot of drug questions are coming up. You choose what is going to be your plan for 2024. So whatever decision you make during that time period becomes effective January 1. So why do I believe this person should keep a plan? There's two main reasons. First being that for every month that you don't take a Part D plan when you are eligible, if you later decide to sign up for a plan, you're going to have a penalty for each month stacked on top of each other. So again, if you never sign up, you will not have penalties. But let's say like my client who called me recently, she's 80. She was not my client when she first started with Medicare 65 and she chose not to get a plan. Now all of a sudden she has these expensive drugs and she's calling me trying to figure out what to do. But for every month of those 15 almost years, there's a penalty stacked on top of each other and it would stay with her forever. So now she's got other things to weigh. What's going to be more cost effective? Not having a plan or dealing with the penalties, but also getting coverage. So that's the first reason. Let's avoid penalties. The next reason, and by the way, know that there are very low premium cost plans. There could be a plan for $0 or $10 or depending on your state and your zip code. So that's something worth looking into. The other thing is that if mid-year, let's say you're new to Medicare and under those circumstances, you didn't take a plan and here we are now and it's May and you get a diagnosis that requires very expensive medications. You cannot then jump into the plan mid-year. You have to wait until the next Medicare AEP, October 15th to December 7th, to get a January 1 start date. So you got two things going on there, the possibility of penalties and the possibility of your health changing. So my advice to you is get into a Part D plan. If you're not on medications, find one with a lower premium or a very low premium. And then each year you can reassess this decision.